Go over to the magic wall, Dr. Kennedy. I want to tell you what, I'm going to have you just kind of watch from their bird's eye view. First things first, this is an example using this technology of someone who was suffering from very significant heart disease. Highlight to us what we're looking at here.
Yeah, this is a person with what's called angina pectoris, or chest pain from a blocked artery. And in this picture of the cardiac CT angiogram, if you focus your attention here, you can see an hourglass narrowing. It looks just like an hourglass.
See all that right in there, everyone? How it narrows down there? That's the narrowing you're discussing.
That's right. And this blockage in the artery prevents blood flow to the downstream muscle and causes chest pain or shortness of breath, or angina pectoris.
This is what they call the widowmaker.
That's absolutely right, because it's such a large area of muscle that it supplies that when it gets blocked, unfortunately, it makes widows.
And what we're looking at here, this is actually Janet's CT scan, correct?
This is Janet's three-dimensional cardiac CT angiogram, and what we see here is very smooth, beautifully flowing arteries. That's the top artery. This is the side artery known as the circumflex, and here's the bottom artery called the right coronary artery. And they're beautiful, they're smooth, they're without blockages. However, this is not really the whole story, because when we take a closer look, we see Janet's right coronary artery, and the area that we want to focus on is up here. This is plaque, and it's on the outside of the blood vessel. The area that we see in white is the blood flowing through the artery, and this black area that I've circled is what's called an atheroma, or the plaque. That's the beginning of atherosclerosis, or heart disease. This is what causes heart attack. And this is important to identify, because when you have this, that tells us to be very aggressive with risk factors. Lowering your cholesterol, lowering your blood pressure, treating your blood sugar, incredibly important. And one other fact I'll make is that most heart attacks are not caused by a severe narrowing. Most of them are caused by blockages just like this one. This is sort of a weakening in the blood vessel that's vulnerable to tear or rupture. And once it tears, your body clots off to try to heal itself, and that clot then blocks blood flow to the heart muscle, which is what causes a heart attack.
It's why heart disease is a process that gradually develops over time, but a heart attack is truly an attack. If that plaque ruptures, platelets come in, blockages occur, chest pain. But Janet, the good news is the whole point of doing this was to see what your CT scan looked like, and you saw some buildup there. So this is I'm going to say only that is good news in the sense that now we can be proactive about it. Mm-hmm. So let's talk about anyone at home. Let's say you have this done, or you know you have some of these plaque buildup. What can Janet and people at home do?
We can lower your cholesterol. We can get you on a regular exercise regimen. We can keep your blood pressure perfect. We can keep your blood sugar in check. And we literally can make this, heart attack and what happened to your father and grandfather something that's very unlikely.
And I want everyone to pay attention, because everything Dr. Kennedy just talked about, they are silent things. You don't necessarily know if you have high blood pressure, high cholesterol, high blood sugar. That's why you need to talk with your doctor about preemptive measures.
And here's something I'll add to that is, I hear this so many times in my practice every day. Look, hey doc, I diet, I exercise, I do everything right, and I still don't have these 5 numbers. And there are literally 5 numbers that'll save your life. You got to get your blood pressure normal. It's got to be less than 130, less than 80. Your cholesterol needs to be less than 200. Your LDL needs to be less than 100 for you, in your case. Your blood sugar fasting should be less than 100. Your body mass index should be less than 19. And you should exercise, for you, 15, 20 minutes walking briskly 5 days a week. If you've got those 5 numbers, you will literally make heart disease incredibly unlikely and change your course for the rest of your life.
And if despite everything you do on your own, your blood pressure is still out of whack, your cholesterol is still high, that's when you talk with your doctor, because there can be additional medications that you can be started on. We're going to give you 1 year of coaching with registered dietitian and nutrition expert Sumner Brooks.
Okay.
And we're also going to give you 1 year of training sessions with Matt Surgott Fitness.
Okay.
We're going to kick it up a notch. We're
Wow.
going to take it
Okay.
to a new level.
That's
you
great.
up for it?
I am up for it.
We wish you the best of luck. Thank you so much.
Thank you very much.